Asymmetrical tonic neck reflex, ATNR. The video that I will be referring to is video number 3, which shows the ATNR reflex. This is known as one of the many infant primitive reflexes, which is an involuntary movement pattern that we are all born with. The ATNR is often called the fencing reflex due to the fact that when an infant is lying on their back and their head is turned towards one side, the arm on the same side will extend while the opposite arm will flex in towards the body, looking like they're ready to fence. The ATNR typically emerges at approximately 18 weeks in the utero and should be fully developed by birth. It is most noticeable between 1 and 2 months of age. It often is used to help infants start developing hand-eye coordination as they begin to look and reach for objects. The ATNR typically integrates by 6 months of age, though timing can be different from child to child. Integration refers to the reflex no longer being present in a prominent way and being replaced by voluntary control of movement. If ATNR persists by 6 months of age, it may indicate a delay or an issue in motor development. A retained ATNR can interfere with the development of skills such as crawling, sitting, and hand-eye use, and can lead to challenges with fine motor and gross motor skills as the child continues to age. Implications of a retained ATNR. Implications can include motor development delays as it can interfere with the development of essential motor skills such as rolling, crawling, and hand-eye coordination. It can also cause difficulty with bilateral coordination, such as the child may struggle with tasks that require both hands, like holding a pencil or using both hands to manipulate objects. It can also cause difficulties with postural control problems. If the reflex remains active, it can affect the development of proper posture and balance. And lastly, it can cause learning difficulties. In some cases, it can be associated with learning and attention deficits due to the impact on coordination and visual processing. Implications of integrated ATNR. When ATNR integrates, normally by the time the child is 6 months old, it is no longer an issue. In fact, it is a positive sign that the child is developing properly. The integration of ATNR allows for the development of more complex voluntary movement patterns that contribute to skills like sitting, crawling, and grasping. No complications arise if it integrates at the expected time, as this is part of typical development. Testing the ATNR. The child is placed in a comfortable, supported position, typically supine. The therapist or caregiver gently turns the child's head to one side. When the head turns to the side, the arm and leg on the side that the head is facing will extend, and the arm and leg on the opposite side will flex. This is the typical response associated with the ATNR. This response should be present in infants between 1 and 6 months and should disappear by 6 months. ATNR is important for early development, especially for the following reasons. Number 1, it promotes hand-eye coordination. It can help the client learn to visually track objects and reach for them. 2, it facilitates early movement patterns. It supports the development of the child's ability to move in a coordinated manner, including rolling, reaching, and hand-eye coordination. And number 3, it helps establish symmetry in movement. The ATNR is a precursor to more integrated voluntary motor movements, which are important for later skills like crawling, walking, and handwriting. ATNR plays a key role in a child's development. Motor control development is important. It helps develop gross motor skills, including posture, balance, and coordinated movement patterns. It also helps with visual and spatial awareness. The reflex supports visual tracking and development of hand-eye coordination, which are crucial for later skills like reading, writing, and participating in active sports. It also helps with bilateral coordination. By integrating the ATNR, the child can move towards using both sides of their body together, which is vital for tasks such as using both hands in activities like cutting, drawing, or playing. An activity that can be used to address with a child that has a ATNR reflex that persists is a reaching activity. So you can have the child on a quadruped position And you can use a favorite toy, something of their interest. So for example, let's just say this would be the toy that the child likes. So you're going to go ahead and place that toy in out in front of them, right? And so let's say this is the child. You're going to go ahead and place the child prone, and you're going to have the child look at the toy and reach for it. And as the child reaches for the right hand, you're going to gently turn her head to the left. And then you can encourage her to do the opposite, reaching with the left hand and turning to the right. This activity is beneficial for a child that has a persistent ATNR reflex. It gently helps the child to initiate the ATNR reflex. It encourages the child to reach for the toy of their choice with the extended arm and the head turn. This is promoting symmetrical movement patterns, and the goal is that over time the child will practice reaching and grasping with both hands. You can also work on movements that promote the development of this, such as reaching for different toys on both sides of the body, using both hands for single tasks. And the exercise here will help with bilateral coordination, and it encourages the child to integrate both sides of their body effectively, which is important for developing motor control and preventing any dominance of the reflex. By addressing this ATNR and supporting the integration, the child can develop smoother, more coordinated movements, and they can avoid any type of developmental delays that can arise from this retained reflex. Here's a picture of my daughter engaging in the primitive reflex ATNR for reference.